Welcome back, everyone. Sarah Wilkins is with us today from Lima Memorial. She is a physical therapist assistant there, and we're talking about, I've got my cheat sheet so I didn't say it wrong, myofascial decompression. We're going to call it MFD because that's so much easier for me to say. Tell me, first of all, if you could, what is that?
Yeah, hi, Jeff. So myofascial decompression, or MFD, is a type of manual technique that's grounded in kinesiology and functional anatomy. Cups are used providing negative pressure to the tissue where space is created between the tissue and the fascial layers to help with tissue gliding and mobility.
Well, and you just mentioned it. I've heard of this idea of cupping, and I've seen people do that. How does this compare then to this?
Yeah, so cupping is actually an old Chinese medicine that is used for energetic imbalances and to promote relaxation. There is no movement component whatsoever with the traditional Chinese cupping.
I gotcha. Okay, so if we think of a patient that might be ideal for MFD, what kind of conditions are you thinking of there?
There's actually quite a few many conditions. There are some stipulations that somebody may not be appropriate, but that's of course determined maybe at an evaluation or something. But typically, we treat orthopedics, sports-related injuries, post-op recovery, or just somebody who is dealing with decreased functional mobility due to loss of range of motion.
So as you said, a long list of folks can benefit from this. If someone comes in, especially for the first time, kind of walk us through what can they expect from this?
Yeah, so treatments are typically based off of a plan of care established by an evaluating physical therapist to address goals set ultimately to improve quality of life and to help promote or restore the patient to their prior level of function. When performing MFD, cups are typically in place no longer than 5 minutes, where one session, the clinician, such as maybe myself, would be performing range of motion while the patient gets to relax. And then a session where the patient has exercises that they're instructed through while the cups are in place. The reactions can typically range from where the cups can look puffy or feel hard, and sometimes some appearances of redness or even bruise-like conditions, but that depends on capillaries that are present in the area.
Okay, it's a wonderful, it is fascinating to see. If someone is interested, maybe come in with you guys and have a consultation first and see if it's the best thing for them.
Yeah. So Jeff, what they would want to do is a patient would need to get a script from a doctor first, and then they would be scheduled for an evaluation by one of our physical therapists to assess their impairments and dysfunction with interest in pursuing the MFD as the primary mode of treatment.
Yeah, as you said, it's had wonderful results. Sarah, thank you so much for telling us about it. We appreciate it.
Yes, thank you very much.
You bet. Nice chatting with you. We'll be back right after this.